let's talk about an STI today, and in particular, because today is the World Cancer Day, I want us to reflect on an STI that is implicated in causing a variety of actually very common cancers in our population. Yes, so my name is Lucy and I am excited that you tuned in. This is X-Lab Diagnostics Africa, and we are here to provide you with solutions that are tailor-made for you to improve and to prioritize your sexual health. So today I want us to reflect on an STI called the human papilloma virus, and I'll be using my computer on the side here. So the human papilloma virus is a sexually transmitted infection, yeah, and it is a very common infection within our population. Usually in every 10 people, 7 of them have a HPV infection, or they have had a HPV infection at some point in their life. So you can see it's quite a prevalent kind of STI. Now, HPV virus has many different strains or types. We have low-risk HPV, we have high-risk HPV. So we have over 100 different types of HPV infections. And 30 of these infect the genital mucosa, and that is why they are connected with sexual transmission. And 15 out of these are actually cancer-causing. Now, some of the harmless ones will cause things like warts, and then we have now those that are cancer-linked, that sometimes you actually get a HPV infection, it clears up with time, but then others will persist without any observable abnormalities, and others will actually persist with some abnormalities, and then we have a few HPV infections that will persist and progress to cancer. Now, some of these, especially that are now leading to cancer, will be like those that are caused by high-risk HPVs like HPV 16 and 18. And in women, these strains have been shown to cause cervical cancer, vaginal cancer, vulvar cancer, anal cancer, as well as head and neck cancers. Now, in men, these high-risk strains have been shown to cause penile, anal, head and neck cancers. Now, today I mentioned that it is World Cancer Day. And, cancer is not a walk in the park. And for all of us here, especially those that may have been affected in one way or another by having a patient, or probably you are the patient who has survived or is going through treatment and so on, I know that this is one of those diseases that you get, and you know that it's a chronic illness that is almost a death sentence. And as I speak this, I also have had that journey of losing 2 parents, yeah, out of cancer, and it is quite a difficult journey. And being in Africa, where we have a lot of challenges when it comes to care, in terms of access to quality and also financial implications of this disease, then you know that it is quite a difficult journey. Now, I want to reflect on cancer because when it comes to HPV and the fact that it's also sexually transmitted, and we will also be seeing that it can be transmitted through other contagion of skin to skin, then it means that there's something that we can do and eventually avert the occurrence of cancer. In Kenya today, the theme for today was United by Unique, and I think I liked it. I didn't like it, I loved it, because having been affected, United by Unique simply means that coming together, yeah, but as we come together, we are dealing with a unique problem, because cancer affects every individual differently, depending on which type of cancer, also depending on the age of the patient, depending on how well they are able to access Medicare. So every journey is essentially different. We have journeys that end in, surviving. We have journeys that end in death, so the journeys are quite unique. And when we say united by unique, that simply says that then we can have all concerted effort from government, from individuals, from the healthcare systems and all that, coming together to give personalized care for the patients and also those that are affected. So I want us to look at one of these cancers that are caused by HPV, the commonest of all in women, which is cervical cancer, and it is actually among the leading causes of cancer deaths in women in Kenya and also globally. So it is worth our learning. So the HPV virus usually will penetrate the cervical tissue, through the vaginal canal, then it will localize within the cervix. And that is where you will have the HPV infection. And the cervix is the opening into the uterus. So within this area, we have layers of epithelial cells, the mucosa, having several layers of epithelial cells. So what happens is that at this point, then the virus is going to uncoat, release its viral DNA. When viral DNA is released, it goes into the nucleus of the epithelial cells and it is incorporated within the host DNA. And then there will be a process of transcription into what we call mRNA for E6 and E7. Then the mRNA is going to be translated into E6 and E7 proteins. And these proteins are the ones that now will disable tumor suppressor proteins within the cells. And these tumor suppressor proteins usually prevent proliferation or overmultiplication of cells. So when they are disabled, it means that then the cells can over multiply, leading to cancer. So what happens is that now these abnormal new cells will start to invade the healthy ones. Of course, make sure that they do not have enough nutrients. So you find that now the healthy ones start to die, and that is how the infection progresses. So usually we do what we call a pap smear test for cervical cancer diagnosis. That is what we call a gold standard test. But we usually also have preliminary tests that you can do to detect HPV itself. So we can have rapid diagnostic kits that detect HPV from swabs and also urine. We can also have molecular-based tests which can detect like the HPV DNA within your system. And of course now we have this visual cytology test that now picks up cells from your cervical lining, then places them on a slide, makes a smear, and observes through the microscope. So we will have now how the normal cells look like, the normal cervical cells look like, and how the abnormal cervical cells look like. And you can see now the cytological images here where we have the normal and we have the cancerous. And of course, for every cancer we have grades. We have grade 1, 2, 3, and so on. So even in cervical cancer, we have low grade, we have high grade, and of course we have now when we have the cancerous lesions. So then the most important thing at this stage, therefore, is how can we prevent HPV? Now, one of the ways in which we can prevent HPV is definitely getting vaccinated. In Kenya, we are now vaccinating girls 9 to 12 years of age. But worldwide, we also have HPV vaccines for both boys and girls, or men and women up to the age of 26. So we do it earlier on because that is when sexual activity begins. And then we now, once you put it at that earlier stage, then you're saying as these individuals become sexually active, then they are protected against getting HPV, which is the one that persists in later years to result into cancer. Now, if you are sexually active, use protection. But then it has been shown that actually condoms do not 100% protect you from HPV, because I had mentioned earlier that HPV can also be transmitted through skin to skin, and you can imagine that even the handling of that condom, and then it doesn't cover the whole of your skin, the genital skin, it doesn't cover 100%, and that means that it can also submit, doesn't protect you 100%. Then if you get things, simple things like genital warts, it is important for you to get tested and avoid having sexual contact. Of course, avoid multiple partners, and most importantly, I had mentioned here in a previous video that these sexually transmitted infections most of the time are asymptomatic, meaning you don't have any signs and you feel you are just fine, yet you're submitting, and it's also colonizing within your system and persisting and may cause problems in the future. So therefore, screen, do a test. Yes, do a test to just make sure that you are having a clean bill of health. Now, there are some myths concerning HPV infection, and also the HPV vaccine. Now, one of them is that HPV is not common and it only affects women. Now, that's a misconception, maybe because of a lot of advertisement on cervical cancer, because it's a major killer cancer among women. Maybe that's why. And usually we don't mention a lot about men, but HPV is very common and it affects both men and women 80%. Now, there are treatments for HPV. We do not have treatments for HPV, but we can be able to treat the precancerous lesions that will occur when you have an infection. So the warts and also some early lesions that you are likely to get within your genitals, those are treatable. Now, that giving the HPV vaccine early at 9 to 12 will make teenagers and young people more sexually active, not really. It doesn't, there is no research that has shown that there is an increase in sexual activity. So the vaccine may have some medical effects. It is a safe drug, so of course we cannot rule out 100%, but it is a safe drug. Then you must have sexual intercourse for you to get HPV. Now that's a myth. I mentioned that it can be spread through other intimate forms of skin-to-skin contact. That does not necessarily involve penetrative sexual intercourse. Then HPV makes becoming pregnant difficult. Maybe the worry of we are giving this to young girls and what will happen to their future. Are they going to become pregnant or not? No, it does not affect fertility, and therefore women who have received this, or even men, are going to be able to get pregnant. And neither does it affect pregnancy in case you get the HPV and you're actually pregnant. Now, another misconception that is essentially with many sexually transmitted infections is that HPV means that somebody is unfaithful in the relationship. No, because you can get HPV earlier, even before your current relationship, and maybe it became dormant and it resided within your body, not causing symptoms, and maybe have stayed for a long period. So it doesn't necessarily mean somebody is unfaithful. And like we mentioned, it can be transmitted through other intimate skin to skin. So it necessarily does not mean that somebody was unfaithful. Now, I know you're probably asking, because here in Kenya we only do HPV vaccine for girls. So why are we protecting her sexual health and we are not protecting his sexual health? Now that is for another video. So kindly subscribe to this channel so that anytime this video comes up, you will actually know. Now, what is important right now for you and for me is to try and eliminate HPV through those methods we have discussed, and eventually eliminate cancer. So I wish all of you Happy World Cancer Day. Happy not because we are not affected, but because now we know some of the ways in which we can prevent a cancer or some cancers by screening early and those others that we have said. So thank you so much.